Hello, my name is Katie O'Keefe. I'm a pediatric nurse practitioner, and my practice is with the Creighton University Pediatric Infectious Diseases Division in Omaha, Nebraska. I also am on the faculty at Creighton University School of Nursing graduate program and teach pediatrics for the family nurse practitioner and acute care pediatric nurse practitioner students. NAPNAP's Provider-Focused Immunization Webcast is a three-part video webcast providing education to pediatric healthcare providers about clinical practice related to immunizations. In the United States, we have the good fortune of access to several safe and effective vaccines, as well as an excellent array of resources to keep us up to date on the latest indications and schedules. We begin this webcast with a review of currently available vaccine resources, followed by a discussion of the utility of these resources for the clinician. As you can see, there are many valuable and authoritative resources available on the Internet. The Centers for Disease Control website should serve as the primary site for the most current and accurate information. I will discuss some of these resources in more detail in the next few slides. The first step in the research and development of a vaccine is the clinical trial for safety and efficacy. During this process, vaccine manufacturers must meet exacting FDA standards and pass several ongoing inspections. Once the FDA licenses a vaccine, then the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, otherwise known as Aesop, begins their review. Aesop consists of 15 experts, selected by the Secretary of the U.S. Department of Health and Human Services. Aesop members are full-time clinicians, academics, and state public health officials. They review new vaccines and new uses of existing vaccines and make recommendations to the CDC on which vaccines should be routinely administered, as well as the number and intervals of dosing. The Aesop meets 3 times per year, and the dates are posted on the CDC website. As you review this page, you will find that you can view the agendas, minutes, presentation slides, and can attend these meetings in person or by phone. So if you have questions or concerns, you can attend an Aesop meeting, review the meeting's minutes, or contact the NAPNAP Liaison Group representative through the NAPNAP National Office. Next, I would like to highlight the MMWR, one of the best mechanisms to keep current on vaccine schedules and the epidemiology of vaccine-preventable diseases. Every January, the MMWR reports the newest Aesop recommendations for vaccines. Anyone can subscribe to receive the MMWR electronically via email, Facebook, Twitter, or RSS feeds. Another valuable resource for healthcare providers is the Vaccine Adverse Event Reporting site. VAERS is a spontaneous national reporting system that accepts reports of adverse events from anyone, but especially healthcare providers, manufacturers, and individuals affected by adverse events, and parents. It is jointly administered by the FDA and CDC and receives over 30,000 reports annually. Reporting systems like VAERS will continue to be used to monitor adverse events, so vaccines can continue to be held to very high standards of safety. Note the tabs across the top of this page and you will see links to all aspects of the VAERS. MedWatch is the FDA's Safety Information and Adverse Event Reporting Program. Healthcare providers have the opportunity to subscribe to MedWatch safety alerts via email, text, Twitter, or RSS feeds. Next, we will discuss a challenge we have all faced: the infant or child who is behind on their immunizations. There is a tool available for download at the CDC website entitled The Ketchup Schedule for persons aged 4 months through 18 years who start late or who are more than 1 month behind. It provides guidance on catch-up schedules and minimum intervals between doses for children whose vaccinations have been delayed or interrupted. It is important to note that a vaccine series does not need to be restarted, regardless of the amount of time that has elapsed between doses. The CDC website also has an easy-to-use interactive tool, the Ketchup Immunization Scheduler, for children 6 years and younger. This interactive tool can be downloaded and used to determine the vaccines a child needs. It is quick and always will be consistent with the current Aesop recommendations. In order to demonstrate the utility of the Ketchup Scheduler, let's look at a typical scenario. Emma, a 3-year-old child, comes to the pediatric office for a sick visit. The child is diagnosed with a mild viral URI and a serous otitis media. Upon review of the child's vaccination status, the healthcare provider notes that the child is deficient in several vaccines. When asked, Emma's mother states that her last immunizations were given around 1 year of age. What should be the healthcare provider's next step? Well, let's assume that you have the records of the previous immunizations. In this case, the next step would be to access the interactive Ketchup immunization scheduler on the CDC website and generate a personalized Ketchup schedule for Emma. In this screen of the Ketchup immunization scheduler tool, the healthcare provider enters the child's birth date and name, which I took from the case study, selects the schedule type of either accelerated or routine, enters the number of administered doses and dates for each vaccine, and then clicks on Get Schedule to generate a personalized Ketchup schedule for the child. This is an example of a Ketchup schedule generated with this tool. The recommended Ketchup vaccine doses that appear in red are to be administered first, while the doses that appear in yellow are to be administered at the following visit. It is important to note that many missed opportunities to vaccinate occur because a healthcare provider defers the vaccines due to minor illnesses. This is not necessary and oftentimes sends the wrong message to parents that vaccines are going to make the child more ill. So in this child's case, the healthcare provider should offer the vaccines indicated by the red bar today. Another common misconception is that the healthcare provider should limit the number of vaccines given to an infant or child at one time due to the concern of overwhelming the young immune system. The facts are that the fetus begins to form antibodies in utero at approximately 16 weeks of gestation and continues to mature in a robust fashion in the first year of life. Thus, their immune system will respond to multiple antigens by early childhood, far more than today's vaccines contain. By 2 years of age, over 20% of the children in the United States typically have seen more than one healthcare provider. This results in scattered paper medical records. Immunization information systems, previously referred to as registries, help providers and families to consolidate immunization information into one reliable source. This graphic represents the advantages of an immunization information system, as well as the technical assistance available from the CDC by clicking on one of the colored sections illustrated here. If your clinic or practice is not participating in a statewide immunization information system, this would be an opportunity to be an advocate for beginning the training. Using an immunization information system in your practice setting benefits the child, the provider, and those who must maintain records for the school by making vaccine records accessible to everyone. Thank you.